Did you know Effexor, a popular antidepressant, can lift your mood but might leave you feeling dizzy or nauseous right away? Let's unpack that. Hello, I'm David from the Pharmacy Corner. I'm here to break down health topics in a clear, simple way with key facts and practical tips. Let's get started.
Hey there, if you're watching this, you might be curious about Effexor because you're dealing with tough feelings like sadness or worry that just won't quit. That's okay, we're in this together. Effexor is the brand name for a medication called Venlafaxine. It's what we call a serotonin norepinephrine reuptake inhibitor, or SNRI for short. In plain terms, it helps balance chemicals in your brain to ease emotional ups and downs. According to the National Institutes of Health's Medline Plus, Effexor is mainly used to treat major depression in adults. But it doesn't stop there. It can also help with generalized anxiety disorder, where everyday worries feel overwhelming, social anxiety disorder that makes gatherings stressful, and even panic disorder, those sudden waves of fear that hit out of nowhere. If you've been prescribed this for one of those, know that it's a tool many people rely on to feel more like themselves again. Just remember, it's not a quick fix. It often takes a few weeks to notice the full benefits, so patience is key. Picture this. You're feeling stuck in a fog of low energy or constant nervousness. Effexor works by boosting serotonin and norepinephrine, two brain messengers that regulate mood and stress. This dual action sets it apart from some other antidepressants that focus on just one. For you, that might mean better sleep, sharper focus, or the courage to step out more. But everyone's body responds differently, so chatting openly with your doctor about how it's working for you is super important. Now, let's talk about what you might notice when you start. Like any medication, Effexor can bring some common side effects, especially in the first couple of weeks as your body adjusts. The U.S. Food and Drug Administration notes that the most frequent ones include nausea, which feels like queasiness after meals, and sleepiness that might make you want to nap more. You could also experience dizziness when standing up quickly, dry mouth, or trouble sleeping, which is ironic for a mood booster. Other everyday ones are sweating more than usual, constipation, or changes in your appetite. And yes, some folks report sexual side effects, like reduced interest or difficulty with arousal, which can feel frustrating but often improve over time. If these pop up, don't tough it out alone. Your healthcare provider can suggest ways to manage them, like timing your dose with food to ease nausea. The good news? Most of these fade as you keep going, but tracking them in a journal can help you spot patterns. I want you to feel empowered, so let's cover precautions to keep things safe. First off, Effexor carries a black box warning about increased risk of suicidal thoughts, particularly in younger adults or when starting treatment or changing doses. If you or someone you love notices new mood dips, agitation, or hopelessness, reach out to your doctor right away. It's a sign to check in, not ignore. According to Stat Pearls from the National Library of Medicine, another big one is the risk of withdrawal symptoms if you stop suddenly, like flu-like aches, irritability, or electric shock sensations in your head. That's why tapering off slowly under guidance is crucial. Watch for serotonin syndrome too, a rare but serious issue from too much serotonin buildup, with signs like confusion, rapid heart rate, or fever. It can happen if mixed with certain other meds, so always share your full med list with your pharmacist. Pregnancy and breastfeeding. Effexor isn't recommended, as it might affect the baby. Talk options through with your provider. And steer clear of alcohol, since it amps up drowsiness and dizziness. Oh, and if you have high blood pressure, glaucoma, or seizure history, extra monitoring might be needed. Bottom line. You're the boss of your health team. Ask questions, voice concerns, and celebrate small wins along the way. Wrapping this up, Effexor can be a game changer for depression and anxiety, but tuning into your body's signals keeps it working for you. Pair it with therapy, exercise, or support groups for the best shot at feeling steady. You've got this, one step at a time. This video is for educational purposes only, not medical advice or diagnosis. Always consult your healthcare provider before making health decisions.
Thanks for watching the Pharmacy Corner. David here. If this helped you understand your health, please subscribe for more clear tips. What health topic would you like next? Stay well.